Deputy Adams.
Taoiseach, you're critical of the nurses' decision to strike. You say this isn't going to solve the problems in A&E, but what are the nurses to do? We've had a whole series of shocking revelations. For example, and it's been quoted ad nauseum, a man in his 90s being forced to spend 29 hours on a trolley. This is the conditions in which the nurses are working, frontline services. And they're being forced to take industrial action in support of all frontline staffs and in defence of patient care. And those frontline staff and those patients have been let down by your government. And this entire crisis is a direct result of your continued refusal to deal with the A&E overcrowding case and your refusal to properly resource, listen to this, Taoiseach, a public health service. That's the flaw in this whole situation. 2013, James Reilly said, "We will never again see 569 people on trolleys on a single day while this government is in office." But under Minister Varadkar, it's got worse. Increased numbers in trolleys, delayed discharge, a lack of home care packages, a lack of public and other nursing home beds. And our frontline workers perform heroics on a daily basis. In the first 10 months of this year, almost 80,000 admitted patients were on trolleys, the highest ever figure for the first 10 months of any year since Trolley Watch began. Today, this day, as we sit here, and as you joke and banter with Fianna Fáil, there are 339 patients on trolleys on this day. And for the 15th month in a row, October 2015 saw an increase in the levels of overcrowding in emergency departments. Now, the President of the Irish Hospital Consultants Association, Dr Gerard Crotty, has said the cause of A&E overcrowding is a lack of capacity, because not enough money has been allocated with it. So my question, Concordia, is, Taoiseach, will you acknowledge that your government, for ideological reasons, has underinvested in a public health system, that the overcrowding in A&Es is a result of this policy, and that today's announcement of strike action by nurses is an entirely understandable response?
Taoiseach. Well, even you, with your weird economics on behalf of your party, will understand that we did, after all, have an economic crisis in the country here, which necessitated serious cutbacks in a whole range of areas. And you will understand, Deputy Adams, that the equivalent of an increase of 880 million has now been secured compared to the 2015 allocation of 12.295 billion for the health services. As I pointed out to Deputy Martin, the task force set up by the Minister for Health is now beginning to pay its way in the sense of improvement in the situation which applied in the hospitals. Delayed discharges are reducing. That frees up beds. As I pointed out, beds in the community hospital in Mount Carmel have been opened. 300 additional beds will be opened this month and a further 100 in January. There are more staff working, Deputy Adams, than ever before. Since January, there are 500 more nurses in the health service, 500 more professionals in the health service. Since 2011, almost 300 additional consultants have been appointed around the country, including 57 this year. These are consultants, professional people well able to do their job. And the number of NCHDs has increased by 250 since last year. So, I mean, I understand, of course, that the vote was expected in the way that it has been taken, but it's not going to solve the crisis and the challenges that we face in the health service. The Minister for Health, working with the health authorities and the different sectors in the health area, have made significant improvements. We're not where we want to be yet. But obviously the situation is better than it was, and it continues to improve. And as I said to you, 880 million extra has been allocated to the health system than for the 2015 allocation. And that requires, obviously, that every professional in the system, in terms of management and staff and everybody, have got to work together. You can't blame nurses for the situation here. This is an across hospital, across health sector situation, and everybody's got to make the best effort that they can in the interest of the patients whom they serve. So the situation is has more facilities, more personnel, more money allocated to it than before, and obviously the management of that in the interest of providing better services for patients are what's paramount for everybody. So I do hope that that the INMO and the state's machinery will be able to work out a situation where you don't have to have a strike coming up to Christmas.
Deputy Adams, 1 minute, thank you.
Well, Taoiseach, is this all a pretense? Is this, are people making this up? Isn't there a crisis in our A&E departments? Isn't there a crisis with patients on trolleys? Isn't that the case? So you talk of weird economics. What sort of economics is it that puts money into the pockets of the elites and doesn't put it into public services? Riddle me that, Taoiseach. That's nightmare economics of the Fine Gael Labour kind. Last week, in the dying days of your government, you abandoned your flagship health policy, one of the central planks of your programme for government, one of your 5-point plan. You get rid of it. You have no public health policy, Taoiseach. You have no commitment to a public health service. Minister Varadkar, if he would just be queuing for a Bombachit, should perhaps explain to you why he said that hospital groups should be able to conduct business in the manner of semi-state companies, outside the constraints of public service rules.
Question, please.
He has made it clear that CEOs of hospital groups should be allowed to transfer management of hospitals to private providers. So where's the commitment? That's all about privatisation of what should be an entitlement of a citizen. So this is an insight, and I'll finish in this, Ceann Comhairle, into your government and how it presides and why it presides. You have to ask the question, why is this so? Why are we in this difficulty at this time? Why are the nurses going out on strike? It's because your long-term plan, and you not just admit this, your long-term plan is to abandon even the pretence of public ownership models of healthcare, and that's why you will not adequately invest in the public health system.
Thank you.
Taoiseach. Well, can I repeat for you, Deputy Adams? There are 700 extra nurses employed in the system now. These are real professional people. Now, I've said to you that 300 additional consultants have been appointed since 2011 and 57 this year. These are professional people. Now, what do you want to do with the consultants? What does the Sinn Féin party want to do with the consultants? You want to drop their pay and increase their taxes. Yes, you do. Yes, you do. That's what you want to do. And the situation clearly, Deputy Adams, if you examine the facts for once, is that the HSE and the Department of Health have difficulty in recruiting consultants to work in our hospitals because of the remuneration levels. And you go around the country saying the wealthy, their consultants must have their pay reduced and their taxes increased. And you'll do the same.
Please, Deputy.
You'll do the same with the nurses and everybody else, because your party proclaims that everything is free in this country, but somebody's got to pay at the end, and increased income taxes where you are based. I've said to you, the situation insofar as prevention, capacity and community are all being addressed through extra facilities, extra personnel, extra resources allocated by the Minister for Health to this particular situation this year. And it's better than it was in August, and it's better than it was in January. And if you had anything constructive to say, you might point out the good things that are happening in here while we attend to address the challenges that remain. So I do hope that the INMO and the Secretary-General chairs the task force, which is now paying dividends. I do hope that they can sit down rationally and avoid a strike of nurses, so important to our system coming up to Christmas.
Thank you.
And I hope that can be concluded successfully.
Thank you. Deputy Fitzmaurice. Thank you.